Okay, everybody, we're going to go ahead and get started. First and foremost, we'd like to thank everybody for making the time to join us this morning. I know it's a very busy time of year for all HR and finance professionals as we head into the latter part of the year. So we appreciate greatly your time and attention this morning for this very important conversation. My name is Alex Meckling, and I am the Senior Vice President and Managing Director of the Employee Benefits Division here at the Fidelity Group. Today, we are going to be talking about an important topic concerning the engagement and empowerment of your Medicare-eligible employees. Before we get started, I'd like to go over a couple of housekeeping items to help you maximize your participation in today's event. You may have joined the presentation listening using your computer's speaker system by default. If you'd prefer to join over the telephone, please just select phone call in the audio pane, and the dial-in information will then be displayed on your screen. You'll also have the opportunity to submit text questions to today's presenter by typing them into the questions pane of the control panel. You may send in your questions at any time during the presentation, and we'll collect these and address them during the Q&A session, which will occur at the end of the presentation. Today, we are privileged to welcome our presenter, Kathy Herco. Kathy is the founder and president of CAS Company, which is the preeminent Medicare insurance agency in Ohio. Kathy has represented a multitude of companies for the last 12 years and has been featured on WKYC, WTAM, and every Sunday on WEWS. Knowing Medicare can be an overwhelming and confusing maze, she works with people, educating them to find the plan that best suits their specific needs. In her free time, Kathy is passionate about giving back. She is the co-founder of Stuff the Bus and Kids in Need Resource Center. She is also an active member of Coach for Kids, Boomer and Beyond, Professional Networking Group, and Independence Over 55 Group. She currently serves as Vice Chair of University Hospital's Senior Network Board. The Fidelity Group is privileged to be partnering with Kathy and CAS Company to present today's presentation and to help our clients, the folks on the phone, and your employees navigating the Medicare maze. For today's discussion, we're going to start out with discussing the HR dilemma as it pertains to Medicare, the basics of Medicare, helpful strategies for HR professionals when addressing Medicare questions from your Medicare eligible population, resources that are available to you and your employees that may be questioning things about Medicare, and then open it up for Q&A. So starting off, the HR dilemma, how did we get here? So for the vast majority of people, the healthcare ecosystem and benefits in general is a very confusing, complex maze. Most people spend their entire working careers accessing the healthcare system through their employer-sponsored benefit program. This makes the role of the HR professional a really critical piece of the healthcare ecosystem. And while we spend our working careers relying on our HR teams, once we reach age of retirement or age 65 and shift towards Medicare, we're often left with very little in the way of resources and information about how to even start the Medicare process and how to make the best decision for ourselves and our loved ones. We believe at the Fidelity Group, as does CAS Company, that this can and should be different. We believe that employers and HR professionals are in a unique position to be able to empower working Medicare eligible individuals or folks retiring and heading into that next phase of their life to navigate this Medicare system in a way that is helpful to them and allows them to maximize their decision-making power. We believe that HR professionals often are left with very little in the way of resources, and that we can provide you with support and assistance to empower these individuals. And that's really what today is about. We think that this is an important conversation, certainly with the demographics of Northeast Ohio and Ohio in general being what they are, but also because of the strain that has been placed upon working folks and folks that may be interested in retiring due to the COVID-19 pandemic. We believe that makes this conversation particularly timely and are excited to share some information. So with that, I'd like to hand it over to our presenter, Kathy Herco, to start with an overview of the HR dilemma.
Thanks, Alex. Good morning, everybody. Thanks, Alex, for allowing me to be here today. And I also want to thank everybody who is on by phone or computer audio for taking the time to, as to what Alex refers to as the HR dilemma. What is the HR dilemma? Approximately 3.8 million baby boomers are expected to turn 65 each year, which means there's about 10,000 people a day turning 65. And when they are turning 65, they are going to be provided, sent, called with information as to, are you going to utilize Medicare or not, and if so, when, how, so on and so forth. Most baby boomers are not exiting the labor force, unlike older adults in the past. Boomers aged 65 to 72 were working or looking for work. This is true because Social Security total benefits, as the years go on where we are born, it's delayed by a month, 2 months, 3 months. So many of them are choosing to work until they can collect full Social Security and also later. 66% of adults ages 54 to 64 were in the labor force and are still in the labor force. Employee expectations of their employers. What is that? So many of the people we sit and speak with say, well, up to now, I totally relied on my employer as to direct me to, do I want this plan or this plan? So what is the employer, the expectation of the employee? That you can direct them to an individual resource where they can get the information to Medicare, because obviously that has not been your priority, and we understand why, but they're so reliant upon you for information. And as we all know, HR individuals are continually aligning pieces of what is called now the diverse workforce puzzle. 47% of Medicare beneficiaries and 57% of those nearing eligibility admit that they are completely overwhelmed. And in actuality, I think there's even more. So many people come in and say, the more I read, the more confused I get. Many of those nearing eligibility don't know where to start. They don't. They get a lot of information in the mail, and they come in to us with this bag of information and say, the more I read, the more confused I get. 19% of Medicare beneficiaries do it without help, which means we say to them, if they come to us after they've picked a plan, well, how did you determine your original plan? Well, I talked to my brother, I talked to my sister, I heard it on the news, I heard it on the radio. And half of Medicare beneficiaries and 3 in 4 Americans nearing eligibility will choose a plan based on affordability. They choose plans based on affordability, lifestyle, medication costs. All of this comes into play as to how they can make a decision.
Kathy, thank you for setting that stage for us. I think as a starting point, can you take us through a high-level overview of Medicare and how it works?
Sure. I will be glad to do that. So what is and what is not Medicare? Medicare is a federal health insurance program, and it's at all U.S. citizens and legal residents, they are able to get it. It is funded in part by taxes you pay while working, and it is individual. It's very individual. People come into us and say, well, my husband and I have been on the same plan. We're on a family plan. Do they offer family plans? No, they don't. It's very, very, very individual. But our needs are very individual. What Medicare is it's not a family health plan. It's not Social Security. And as many people will say, we need to get information about Medicaid. No, it's not Medicaid. Medicaid is for impoverished. And it is free for Part A. However, Part B and the supplements do have a cost to them. Social Security, I'll touch on it very briefly. Consists of retirement, disability, and survivor benefits. Can start receiving benefits at age 62 or as late as age 70, which is another reason why people choose to continue to work longer. Full retirement age, as I had referenced before, depends on the date of your birth. And it is true, the longer you wait, the higher your monthly benefit will be. You can get Social Security retirement benefits and work at the same time. However, I do know that there are different amounts that you can get while you're working. And Cas Company is not Social Security. We can reference some Social Security information. We focus on the Medicare side. Social Security. Why does this come into play? Because as your employee is turning 65 and saying, well, I'm not going to retire for another year, year and a half, but now they're starting to truly plan about retirement. And one of the questions people will call us up and say, okay, I'm planning to retire in a year, year and a half, 2 years. Should I start looking at what some of my medical costs will be? We recommend that people will do that because when they're planning, they want to know what kind of costs they're looking at. Who can get Medicare? Legal residents who live in the U.S. for at least 5 years, including the 5 years just before applying for Medicare. They must meet a couple of requirements. They must be age 65 or younger than 65 with qualifying disability, which means a lot of people, and maybe it's not your employee, maybe it's your employee's spouse, they're collecting disability. And if you are collecting Social Security disability for 24 months, they are eligible for Medicare. And many times people will go, oh, I've been on my husband's plan, or my wife's been on my son, they can get Medicare once they've been on disability for 24 months. And yes, they do need to have paid for 40 quarters, which is 10 years, unless, of course, they have the disability. So people will say to us, what is A, what is B, what is C, what is D? That's what Cas Company does. They help them to understand A, B, C, and D. What is Part A? Part A is the hospital side. Inpatient hospital, home health services, skilled nursing. There is no cost for Part A as long as they have worked 40 quarters and paid into it, or their spouse has worked 40 quarters and paid into it. There are deductibles and copays, and it can't be denied coverage. When somebody is turning 65 or going on Medicare, we do not ask any health questions. What is Part B? It's everything that Part A is not. It's physician visits, it's your MRIs, your CAT scans, your medical equipment, your blood work, all of that falls under the Part B. There is a monthly premium for Part B, and it is income-based. It's based off of your tax return from 2 years ago. So when an employee is trying to determine, that's one of the things we look at. There are deductibles, coinsurance, it's an 80-20. Again, Medicare A, Medicare B will pay 80%, but what are we going to do for the other 20%? They can't be denied coverage. Now, it is paid monthly from Social Security. It is an automatic deduction unless you are not collecting Social Security. And many times people will say, I'm not collecting, I'm still working. Well, Social Security will send you a bill. You can do EFT, and there is a penalty for late enrollment to the individual unless they have what's considered credible coverage, which would be the coverage that they get through work. And if you do not know as the HR individual, if your plan meets credible coverage in the eyes of Medicare, that's where I'm sure the Fidelity Group could come in and help you out.
Absolutely, and that's information that we help all clients assess, and we do on an annual basis.
And the reason why that's important is so the individual says, well, I'm not going to collect Part B, but what do I do when I go to get Part B when I'm 68 or 69? They will need to take a form from their company, the HR individual, the owner of the business, that proves that they have credible coverage. They take that form and they provide that to Social Security, and that is why they will not get a late enrollment penalty. So it's one piece of paper, but it's a very important piece of paper, and it does start with the HR individual. So as I said, Medicare doesn't cover everything. It does not cover prescription drugs, and we're going to talk about that in a little bit. Routine dental, vision, hearing, glasses, hearing aids. Long-term care or custodial care, this is a big one. And again, you don't need to focus on that. That's where we come in. But a lot of times people will say, my husband's got dementia, my wife's dealing with a major illness and she needs some help at home. That's not covered by Medicare, and we do explain that to people when we're sitting with them. Excess charges for services by doctors in Ohio, they are not allowed to charge that. And care received outside the United States, they do not. Medicare does not cover that. Some of the plans might, but Medicare doesn't. So very briefly, Part A, the premium is zero for most people. Now, there are some people that haven't worked 40 quarters and they're not married. They then get a premium, but that's very unusual. That there is a deductible. Currently, it's $1,408. There's other costs. And note, there is no out-of-pocket limit. So when you see these other costs, well, how does an individual take care of that? That's where they can look at the supplements, Medicare Advantage plans, and what we do. Okay, Part B, which is the medical, the doctor's appointment, the MRIs, the blood work, all of that. The deductible currently is $144.60, and it is determined by Medicare every year. The premium's $144.60. The deductible is $198. And I will tell you, I've been in this industry for 12 years. And when I got into the industry 12 years ago, the deductible for Part B was $141. So I like to say it has crawled to $198. Other costs, again, Medicare covers 80%. So they're responsible for the other 20%. And then again is where we come in. And no, there is no out-of-pocket limit.
And I think, Kathy, you point out something really important there with respect to the deductible for Part B, which the increase in that deductible is far less of a rapid acceleration as compared to what we're seeing on the employer group side with deductibles, which we've seen accelerate rapidly over the last 12 years and beyond that. So I think this is just a good instance where, helping educate the individual that benefits under Medicare may not be an erosion of benefits as compared to their group plan. In some cases, it might be better in the way that the program functions. So I think it's just an important piece that reiterates the importance of engaging these folks to have the conversations with you so that they can make those decisions.
And Alex brings up a good point, because people will say, well, what should we do if we're on our company plan and we're turning 65, or we've never taken the time to look at Medicare? Basically, what we recommend is that they allow us to do a comparison. Let us do a comparison as to what your out-of-pocket costs are. What do you pay for your monthly premium for employer coverage? What is your deductible? Or is your spouse on it? And is there a little bit larger cost for the spouse as opposed to the employee? And when we do the comparison, if somebody has a large deductible, 99% of the time they're going, oh, I don't have to pay that large deductible. No, you don't. And as Alex, as you said, they're not losing medical coverage. And sometimes they are gaining more.
Mm-hmm.
So where can I get more coverage options? Option 1, add one or both of the following: Medicare Supplement, Part D prescription plan. Now, I will share with you that if somebody chooses to go on Medicare, it is not required that they get a supplement. However, they're exposed for 20%, and when they see the cost, they're 9 times, well, the majority, all the time, they're very happy, unless they're getting their medical coverage for free. It is a requirement that they get a prescription plan, even if they are not taking any medications. And again, this is where, when we talk about, does your employer plan meet the definition of credible coverage in the eyes of Medicare, so much of it is focused on the prescription coverage. Is your company plan, do they cover medications as good as or better than Medicare? And if so, then they meet credible coverage and they don't need a Part D plan until they're coming off the employer plan. Or the other option is the Medicare Advantage plan. And a Medicare Supplement and a Medicare Advantage plan are two different types of options. And under a supplement, there's a lot of options, and under an Advantage plan, there's a lot of options. But that is not something that you, the HR individual, needs to focus on. That's where we can sit down with the employee, or if we would do a presentation to your employees, give them a brief explanation of the difference. Part D. What is Part D? Many, many times people will say, what's this Part D thing? Because I've heard that if I don't get it, as the screen says at the bottom, you could get a late enrollment penalty. So in 2006, it was determined that anybody who is on Medicare must get a Part D prescription plan, even if they are not taking any medication. And a large majority of the individuals are taking medications. They're taking maintenance medications. They may not go to the doctor, but they are taking those medications. They come as a standalone, or they can come with an Advantage plan. What is a formulary? A formulary is a list of medications that each plan covers. Medicare requires that every plan, and there are many of them out there, covers at least 2 medications in every category. But if there's 20 medications under one category and your plan covers 6, we have to make sure that the 6 they cover is one of the medications you take. There are network pharmacies. They pay less if they use the network pharmacies. It's through private insurance companies. Yes, there's a premium. Yes, there's a copay. And possibly there's a deductible. So people will say, okay, what do I do? When somebody turns 64, about 2 months after they're 64, they start receiving a lot of mail. And they'll go, what do I do? When do I do this? How do I do this? The initial election period is 3 months before their 65th birthday, the month of, and 3 months after. They can apply for Medicare then, even if they're not ready to retire now. Sometimes people will get just Part A and not get Part B. Why? I'm on an employer plan. Why do I want to pay for Part B when I'm staying on my company plan? And it is a qualifying event. When can I get, okay, so Medicare supplements are often referred to as Medigap. They are one and the same. There is no medical underwriting. So one of the things people come into our office and they're very, very, very worried. I have a major health issue going on. I had a lady come in, I left the hospital 2 days ago, I'll never get covered. There is no medical underwriting. If they are in their guaranteed issue period, there is no medical underwriting. And you can get a Medicare supplement 6 months after you turn 65 or enroll in Part B, which means I'm 68, I finally decided to enroll in Part B. They have 6 months, up to 6 months after they enroll in Part B, to get a Medicare supplement, no health questions asked, guaranteed issue.
Now, for those that are working past age 65, I think this is an important nuance for those folks that are on the phone, HR professionals, finance professionals that are managing employee benefit plans. You're likely receiving questions about Medicare from those planning to retire, but also those that have reached age 65 and beyond, but are continuing to work. And it's important to understand how to guide these individuals. For those age 65 plus that are continuing to work, they may enroll in Medicare, even if they continue to work during the Medicare annual enrollment period, or AEP, which is the period that begins October 15th and continues on until December 7th. To help you proactively engage with these folks that may be Medicare age, but are continuing to work and stay on the group plan, the Fidelity Group is partnering with Kaz Company, where we will actually be providing our clients with a quarterly report reflecting those enrolled in your group benefit plan that are 65 and older, that would be Medicare eligible, along with a communication that may be sent to them explaining what their options are, providing Kaz Company's contact information, and a frequently asked question document to help them guide their decision-making process. So that's something that we're doing to partner with Kathy and her company to make sure that we are empowering the HR professional to reach out to these folks, give them the information that they need, making sure that they understand what their options are and are able to start, looking at this special enrollment period and make an appropriate decision if they've not considered it in the past. Another important nuance that I think is very important for us to touch on concerns the contributions to health savings accounts. So under the Medicare rules, an individual covered by an HSA may not contribute to that HSA account if they are covered by Medicare. And this also includes contributions from the employer. So that's really important for the folks on the phone. However, they can use the dollars that they've already accumulated in that HSA account to pay for medical expenses, even if those medical expenses occur under Medicare. They're also able to use those dollars to pay for their Medigap and Medicare Advantage premiums, which is a nice feature. So for HR professionals, this is really important for those individuals that you might be reaching out to or that might be reaching out to you, and you're having a conversation about their enrollment in Medicare, guiding them. And if they perhaps elect to enroll in Medicare, come off of your group plan, or in some cases stay on your group plan and perhaps stay enrolled in an HSA, it's very important to document that and make sure that they aren't setting aside contributions into that HSA if they've opted into Medicare, and that you as the employer are not providing contributions to them within that HSA as well under such a circumstance. If you have questions about what can you do in this situation, if you have an employee that you can't contribute to their HSA, but you want to build a different incentive structure for those folks, we can certainly provide you with guidance on what's permitted under the Medicare rules in that situation.
So decisions for Medicare eligible workers. The workers who are turning age 65 and work for a company with fewer than 20 employees, Medicare is their primary. So I work for a company, there's only 11 employees, I'm turning 65. You do have to sign up for Medicare A and B.
And this is extremely important for the folks on the phone. If you have less than 20 employees, what will happen for most insurance companies on the group side, so group health insurance companies, so the United Healthcare's, Anthem's, Aetna's, Medical Mutual, Cigna's, and so on, what will happen in most cases is if you have an individual that's still actively working that is enrolled in your group benefit plan that is over the age of 65, because Medicare would be primary, the group insurance, even if the individual is not enrolled in Medicare, will pay as though the individual is enrolled in Medicare, which means they may reduce benefits on the basis of Medicare is supposed to be primary, Medicare should be picking this up. Us as the group insurer will be paying less. And so that can put individuals that are uninformed about this in a bit of a sticky situation, particularly when you get into the situation of if they're over age 65, they've not chosen to enroll in Medicare, it's outside of that special enrollment period, it can become very problematic. So this is something that, again, the idea here being to empower the HR professional to be in front of these types of situations is really, really important for all employers, but in particular for those with less than 20 employees.
And then organizations with 20 employees or more, the company plan is primary, and then Medicare is secondary. However, this is where we'll get a lot of questions from people who will say, well, okay, so should I even take the time to look at Medicare? I'm going to work, the plan's working, we hardly use it. What we recommend and suggest to people is let's do a quick comparison. So let's take the individual who works for a company that has less than 20 employees. You do have to go on Medicare. Maybe you want to opt out. The individual chooses to opt out and go on a plan that works with Medicare that is not the company plan, because you may pay less. And the coverage could be, if you have a networked plan and they go on a plan with Medicare, they may have the availability of all of the providers in the area as opposed to just the network. That also comes into play for companies that have 20 or more. Okay, well, the company plan is primary. Well, maybe let's take a look. So what we recommend to these people are, let's do a quick comparison. You're not obligating yourself to anything, but you are educating yourself so you are aware of what your options are.
And something I would add here as well, and we'll get into this a little bit later in the presentation, but it's very important to recognize that for companies with more than 20 employees, not only is it possible that for the individual that the coverage and the price point that they could find in a Medicare arrangement is better for them, but from an employer's perspective, it may be better for you as well. The situation often arises, particularly with self-funded clients, where as you look at actuarial risk values, folks over the age of 65 tend to have higher claim costs. And so having that risk attrition out of your benefit plan can be advantageous. That's also true with spouses as well. So one of the things that we're looking at the Fidelity Group in terms of better serving our clients is to be able to provide you with information, not only to help empower the individual, but also to use as part of a risk mitigation strategy for your employee benefit program itself. It's really important to note that you cannot force your employees off of your group plan and onto Medicare. That's not permitted under Medicare rules, but we are able to provide education and analytics to support why providing that education is advantageous, not only for the employee, but for you yourselves as well.
And another thing I'd like to add right here is it may not be the employee who's 65 that's looking for information. You may have an employee that's a son or a daughter, and the parent is saying, I need help, and the son or daughter is taking some time from work to try and get this information. So by providing an option or an avenue of where to get the information, you're also resolving an issue for the employee that's younger but trying to help out their parents.
Absolutely. There's definitely a caregiver component to this, no doubt about it.
So when can I change my coverage? So when somebody turns 65, that's their initial election period. And when somebody is over 65 and still working and they choose to opt out, they can opt out at any time. It's called the special election period, but then there is a time frame in which they need to make the decision, and that's special election period. If you haven't seen them, you will see them, is anybody who is currently on a Medicare plan, the time to make changes is between October 15th and December 7th. So when I'm meeting with somebody, I'll say, well, you know how when your employer handed you your information and said, okay, it's July, you need to make a decision, or it's the end of the year, are you staying with us, so on and so forth. That was the election period. And Medicare annual enrollment is where anybody who's currently on a Medicare plan can make a choice to change their plan, and it doesn't go into effect until January 1st, but it must be done by December 7th. That is called Medicare annual enrollment.
So with that background and context around Medicare and really kind of the high level, what's important to know, the next question obviously becomes, what can you, the HR or finance professional, do to help your employees and potentially help your own employee benefit plan? So we want to walk through a couple of helpful strategies. Some of these we've already discussed in the context of the presentation, but just as a review. The first is to do some data analysis. Those that work with the Fidelity Group know that this is an area that we put a tremendous amount of emphasis on, is the use of data to drive insight and solution building. Medicare is no different. Through our partnership with CAS Company, as I mentioned, we will be providing information to demonstrate what is the risk profile of your actively working over 65 population, and what would your risk profile look like if we had attrition of that population off of your group plan and into Medicare. And so again, the idea here isn't to say that you have to force people off of the plan, or that you should, or that you even can, but to provide you with that insight around how does that shift your risk, and why this education exercise is very important. The next thing is really to review your benefits program, to understand not only the benefits from a healthcare perspective, but also from a financial protection perspective, understanding, how you're helping people plan for the future, retirement and things of that nature, and how that can be meaningful to them, planning ahead and looking toward retirement, of course, which Medicare becomes a very, very crucial part of. Educating Medicare-eligible employees about Medicare. Obviously, that's what we've focused a lot of our conversation on today. And that really is the crux of what the Fidelity Group and CAS Company are partnering to do, to make sure that those people that are approaching Medicare age, are Medicare eligible already, that are really clueless about maybe how to navigate this maze that is Medicare, that we're providing them with information and resources so that they can get the insight they need to make the right decisions. It's also really important from a practical perspective to encourage employees to create a Social Security account. That is necessary in order to sign up for Medicare. What's really important to keep in mind, though, is that just because you create a Social Security account does not mean that you are taking Social Security. So that's a really important nuance, but it is just a good thing to encourage your employees to do as they approach this age, because it's something that will be necessary in order to sign up for Medicare if that is a decision they make.
And if I can add something here, so many times people will say, well, I thought if I'm going to apply for Medicare, I just call Medicare. That is incorrect. They do need to contact, pre-COVID, they could go into the Social Security office. I hear that some of them may be open by appointment only, but they do need to contact Social Security to apply for Medicare A and B. And they can say, I am not applying for Social Security benefits. However, I am applying for Medicare A and B, and that is done through Social Security.
Absolutely. A couple of other quick strategies here. Again, just making sure employees understand retirement programming and planning and how these things all fit together. That includes obviously information about any sort of pension or 401k types of plans that are offered. Providing retirement Medicare educational seminars. This is really important. So one of the things that CAS Company has done for Fidelity Group clients, as well as a lot of other employers across Northeast Ohio and the state at large, is providing Medicare 101 seminars. So the conversation we're having today, we can think of as Medicare 101 for HR and finance professionals, but we can also do this same type of presentation for individuals that might want to learn for themselves about, is Medicare going to be a good option for me? And that's something that Kathy and her team can facilitate. If that's something you're interested in, we will be providing Kathy's information following this presentation, and you can also certainly reach out to a member of the Fidelity Group and we can get that arranged for you. And then also, along with that, providing literature and handouts around Medicare. I mentioned a couple things that we will be sending out to our clients on a quarterly basis, but we can also generate additional literature to provide information that you can use in your benefit communication strategy overall.
And Alex, if I can add something here. If the individual and if the employer should ask you, well, okay, if I call these people, what am I committing to? They're not committing to anything. Mm-hmm. There is no cost for us to come in and do an educational seminar. And then if the individual wants to meet with us on a one-to-one, there's no cost. as Alex said, I am fortunate. I have a couple of segments on TV, and one of the things we stress is there is no cost, there is no obligation, because if in the end the individual chooses to do a plan through us, the plan pays us. And truly, that's one of the things that we enjoy is people come to us so confused, and when we can see how they're relaxing when we're answering the questions, and then when they say, what do I owe you? They don't owe us anything. They truly don't. But it helps to provide some calm. So many employees say, okay, my employer told I had option 1 or option 2. One thing we haven't touched on is specifically Northeast Ohio is a very large density of Medicare-eligible people. And so with that comes many, many, many options, many choices. And people will say, the more I read, the more confused I get. And I get it, because now instead of having 2 choices, you're looking at 10 or 12, and you truly don't know which way to go.
Absolutely. So where can employees be directed? So if an employee approaches you, or you reach out to an employee through the strategies we've discussed, and they have additional questions, where can you direct them? So there's a couple of different resources. There is just Medicare as an organization, which we've put their information up here, in obviously Medicare.gov, the Social Security Administration, and then the State Health Insurance Assistance Program is also available. Our recommendation, of course, would be to utilize the contact information from Kaz Company. Kathy and her team, as I think is abundantly clear from this presentation, are very adept at walking people through this process and making sure that not only do they understand the process, but they understand how to make the right decision for them. So with that, we would like to open it up to questions. First question that we have received. So Kathy, if an employee comes to you and says, okay, I got this information from my employer about Medicare. I don't know anything about Medicare. It's probably not as good as my group plan. How do I find out if my group plan's better, if Medicare's better? What do I do?
The first thing we say is just sit down and give us 10 minutes. No, and in all sincerity, that is one of the biggest points of confusion, is I don't know what to do. I don't know where to go, and I don't even know if I should look at it. So we do recommend, and if your employee should ask you, well, what do we do? The recommendation would be to take the time to sit down and look at, if not with Kaz Company, with Fidelity, then with somebody else, sit down and look and educate yourself to your options. Because, years ago, the company plans, we had our little $500 deductible, and it was pretty inexpensive to be on a company plan. But as we all know, boomers are aging. And as boomers are aging and people age, they tend to use their insurance more. And as they use their insurance more, the costs go up. So we'll say at least get an education to the different costs and the types of plans, because you touched on it. Sometimes people will say, well, what if my coverage on Medicare is not as good as my employer plan? So we'll sit with them and show them. And then it's truly up to the employee if they want to opt out, or if they want their spouse to come off, or the individual who has a spouse who's collecting disability. And there are people out there who are collecting disability and on an employer plan because people didn't realize that they could do this. So, and then the other two things that other questions are, do I have to collect Social Security and do I have to be retired? No, you don't.
Absolutely. And so I think an important question, we talked about not incentivizing your employees, so you can't force them off of your group plan. But as an employer, could I offer to pay for the supplements or Medicare Advantage premiums for an employee if they choose to go on Medicare?
Well, there is a program, and I don't know all the details of it, but I know that you can set up a tax program where you can reimburse, although some employers will reimburse through a check to the individual.
Mm-hmm.
And it is a reimbursement program. It is not where we're paying directly. You cannot pay directly. And basically that comes into play with the supplements, because a lot of the Medicare Advantage plans do not have a monthly premium. And I'm not going to take the time right now to get into that, because that's another whole presentation.
So something else that has come up. So a question that was asked here, and it's a good question. HSAs not being able to fund an HSA before or after one enrolls in Medicare. But what about flexible spending accounts?
I'd have to do some research on flexible spending accounts, but we haven't seen any rules saying you couldn't do that.
Right.
It's the rules we see focus on HSAs.
Correct. That is our understanding as well, is that because of HSAs being tax-deferred dollars being set aside, whereas under an FSA arrangement, you are really making an interest-free loan to yourself. It is slightly different, but we can look at that further and provide that as follow-up.
And if the HSA is for a spouse and the employee, but because we will get this question, well, okay, the employee is not turning 65 and not going on Medicare, the spouse is. Okay, well then you cannot do the contributions for the spouse, but you can for the employee because they are not on Medicare.
Right, correct. So next question we have is regarding incentives. Can an employer provide an incentive for an employee to change to Medicare, similar to what's been done if someone chooses to enroll on a spouse's plan? So in other words, can we offer to say, if you don't enroll in our plan, we're giving you a certain amount of dollars that we would otherwise contribute to your medical premium?
Medicare is very, very strict as to what you can and cannot do as far as incentivizing. I do believe you'd have to be very creative, because they truly say that employers cannot provide an incentive for individuals to go on Medicare.
And when we've encountered this question on the group side, the guidance we've obtained from our legal counsel has been that no, that type of incentive program cannot be provided. And that's because, to your point, Kathy, CMS really gets finicky about any sort of monetary exchange to say, I'm giving you this because you went on Medicare. Reimbursement is different, but to provide an incentive can be problematic.
Reimbursement is one thing, but incentive is a no-no.
Right. So another question that often comes up, Kathy, is with respect to folks that perhaps retire before age 65. What do you recommend to those individuals?
Well, before age 65, I don't mean this in a laughing way, but they do need to work with the Fidelity group. However, when they turn 65, then the option becomes, okay, I have to look at Medicare. Should I look at Medicare? Yes, because you're going to be asked by Medicare, do you want to take Part A and Part B? One of the things we haven't touched on is if somebody is collecting Social Security, Medicare they're going to be sent that Medicare card automatically. But then there's going to be the question, do you want Part B? Part A is automatic because there is no cost. Well, why wouldn't I take Part B? Well, if I'm on a retiree plan, but again, we fall back to that, does the plan meet the definition of credible coverage? And that's a very important question. So when somebody's retired and then they become 65, they're going to have some questions that they need to make some decisions.
Absolutely. I believe that concludes all of our questions. So thank you, everybody that was able to attend. We do appreciate, again, your investment of time. Hopefully you found this beneficial and informative. Thank you, Kathy, for spending time with us and sharing your expertise. We will be providing a recording of today's presentation to all those folks that joined. That will be distributed later this week. Also, please be on the lookout for a blog post addressing any other questions that we may receive after the fact, and those that were asked today as well with answers. Lastly, if you have any other questions, please feel free to reach out to your Fidelity Group team member or to Kathy and the team at Kaz Company, whose information we will be circulating following this presentation as well. On behalf of the Fidelity Group, Kathy and Kaz Company, we appreciate your time this morning and hope you have a great rest of your day. Thank you.